We are all familiar with the coronavirus, or COVID-19, which has become the cause of death of innumerable people lately. Although many health organizations and our governments have resorted to various methods to make us aware of this, it can spread very quickly and cause countless deaths because there is no cure for the virus. A report found that 523 million people worldwide have been infected with the virus so far, of which 6.27 million have died. The COVID-19 pandemic is one of the most severe outbreaks of the century, and it's spreading rapidly. If you're not prepared, you could get sick or even die. The World Health Organization has issued a warning about COVID-19, and it's important for everyone to know what to do if they get sick. In this video, you'll learn about the COVID-19 virus, how it works, and what you can do to protect yourself from catching it. We also suggest some ways to help those who have already caught the virus. We must remember that there is no single answer to the COVID-19 pandemic. As we've seen, different people respond differently to antiviral medications, and some people may not need any medication at all. In the meantime, regular exercise, good hygiene, and avoiding close contact with people who are sick are all important ways to protect yourself from this virus. But how do we know if we have caught it? People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. The most common problems may be fever, cough, fatigue, and loss of taste or smell. But if you notice other problems, such as sore throat, headache and pain, diarrhea, skin rash, discoloration of fingers or toes, red or irritated eyes, if you see any problem like this, then diagnose the disease immediately and take treatment. Even then, if you don't pay attention, you will show serious symptoms such as difficulty breathing or shortness of breath, loss of speech or mobility, confusion, and chest pain, which can lead to death. So it's better to prepare yourself before you get sick or even die. But how? The World Health Organization has issued a warning about COVID-19, and they say to do work from home, practice physical distancing, keep your fingers off your face, and wash your hands with enthusiasm. However, we maintain those rules. We are still affected by COVID. Is there any other thing we should follow to stay away from COVID? Yes, we can boost our immunity system to eat some healthy food and do some exercise at home. One study found that the virus causes a decrease in the number of white blood cells and an increase in the number of inflammatory cells. Another study found that the virus affects how well the immune system defends against other diseases. In such cases, the immune system overreacts to the virus, triggering an aberrant innate immune response that is characterized by systemic inflammation, intravascular blood clotting, and damage to the cardiovascular system. In the journal PLOS Pathogens, they report that, following infection with the COVID virus, the numbers of immune cells called dendritic cells in the circulation decline, while the functionality of the remaining fraction is impaired. The authors believe that this could make patients more susceptible to secondary infections during and immediately after recovery from a bout of COVID-19. These findings suggest that COVID-19 may be particularly harmful to vulnerable individuals, such as older adults and children. So we have to boost our immunity system. The food you eat plays a key aspect in determining your overall health and immunity. Eat low-carb diets, as this will help control high blood sugar and pressure. And regularly consume vegetables and fruits rich in beta-carotene, ascorbic acid, and other essential vitamins. Certain foods like mushrooms, tomato, bell pepper, and green vegetables like broccoli and spinach are also good options to build resilience in the body against infections. You can also eat supplements rich in omega-3 and 6 fatty acids for your daily dose if stepping out to buy groceries is not an option during social distancing. Some natural immunity supplements include ginger, gooseberries, amla, and turmeric. Some of these superfoods are common ingredients in Indian dishes and snacks. There are several herbs that help in boosting immunity like garlic basil leaves and black cumin. Certain seeds and nuts like sunflower seeds, flaxseed, pumpkin seeds, and melon seeds are excellent sources of protein and vitamin E. Drink up to 8 to 10 glasses of water every day to stay hydrated. Hydration will help flush out the toxins from the body and lower the chances of flu. Other alternatives include juices made of citrus fruits and coconut water to beat the heat. A good diet should be followed by an exercise routine. Remember to exercise regularly. Even light exercise will go a long way in releasing the toxins from your body. It is recommended to exercise for 30 to 45 minutes, depending on your stamina. If you have not started exercising yet, then it is a good time to start. Regular exercise improves metabolism, which has a direct correlation with body immunity. After doing all of those protections, you still can infected by COVID. Most people who become sick with COVID-19 will only have mild illness and can get better at home. Symptoms might last a few days. People who have the virus might feel better in about a week. Treatment is aimed at relieving symptoms and includes rest, fluid, and pain relievers. But older adults and people of any age with existing, long-lasting chronic medical conditions should call their healthcare provider as soon as symptoms start. These factors put people at greater risk of becoming seriously ill with COVID-19. People with these conditions who get COVID-19 may also be eligible for specific treatments. These treatments need to start within a few days after symptoms start. Follow the healthcare provider's suggestions about care and staying at home. Talk to the provider if you have any questions about treatments. Help the sick person get food and any drugs needed. Also, think about how caring for a sick person might affect your health. If you are older or have an existing long-lasting chronic medical condition, such as heart or lung disease or diabetes, you may be at higher risk of serious illness with COVID-19. You might think about staying away from the ill person and finding another person to provide care. Also, you might choose to wear a mask that gives higher protection. So guys, tell me, how are you preparing yourself to protect from COVID? Let us know in comments, we'll love to hear that. Stay healthy and stay with Health Conscious.